If you just had a knee replacement and you want to get back to the rowing machine, this video is for you. To be honest, the most important thing is paying attention and listening to your body, which you're probably really familiar with now because you just had a really intense surgery on one or both of your knees. With that comes healing time, and you have to pay attention and honor that. Now, you may or may not be going to physical therapy, or your doctor might have given you some exercises to do. Now, I am a doctor of physical therapy, however, this is not medical advice. Please follow up with your doctor or your PT if you're uncertain. This is general advice to help you get back to rowing, but is not perfect for everybody. So now that that's out of the way, paying attention to your body is really important. How much range of motion you have in the knee is going to be a giant contributor to getting back to the rowing machine. And I do have a whole video on rowing after a total knee replacement and easing back in a little bit, but we're really going about easing back into it in this video. So depending on how much knee range of motion you have, that's gonna significantly impact how far forward you can go at the catch and what you can do straightening wise at the end finish position. Now, if your knee is not all the way straight, you're pretty much going to be in more of this kind of position. Now, if you've seen some of my other videos, I have talked about having a bent knee for certain reasons. So to be honest, this is not the end of the world to have a slightly bent position in the knee, and I actually recommend it to some people. So when you get into that finished position, you're gonna go as far back as you comfortably can. Now, let's go with, since you're on this side for me, let's go with my left is currently the one that is the replacement. If I can get straight on one and I can't on the other, I don't want you to get one all the way straight and keep one bent. I want you to stop both of them wherever the one that can't get straight would stop. So if you happen to have one that's in more pain because say you haven't had that one with a knee replacement yet, whatever your reasoning might be, I want you to keep the two knees equal. The same is gonna happen when we go up. Now start with no resistance, no handle, nothing. Just sit on the rowing machine and go back and forth. Figure out what your range is that you are comfortable with that isn't causing pain in the knee. This is not push into the knee to get that range. I talk about how you can use it for that in the other video on the total knee replacement, but in this video about getting back into rowing, our goal is not to really push the range of motion. The goal is to stay in a pain-free spot. So wherever that position is for you at the catch, that is your stopping point. And again, keep both knees so they are equal. Don't bend one more than the other. Keep them both, otherwise you're gonna do some weird torquing stuff at your pelvis and your hip, which is gonna aggravate other stuff. And you're already doing compensations when you're on stairs and you're walking and all these other things. So let's not add anything else to the mix. Now, another thing to pay attention to is the damper setting or the resistance, depending on your machine. If you have the damper setting all the way up at the top, it's going to make this a lot more difficult for you. I recommend bringing it down to between a 3 to 5 on the Concept 2. If your machine has regular resistance, go something below the middle point to basically make it so that it is easier for you to do something without having an extra aspect to it that honestly isn't really changing your rowing. So have the damper lower, go in a range that's comfortable for you, listen to your knee, and don't overdo it. So the don't overdo it part is if you were doing an hour of rowing every day before you went into your knee replacement and you want to get back, please don't start there. Work your way up. Since rowing has an in and out, constant repetitive motion for your knee, doing something where you're doing that for an hour can be stressful if it's not used to it after the surgery. So start with 5 or 10 minutes. You can try that once, see how it goes, and then the next day, maybe keep it the same, and then day 3, hey, I'm feeling good, let me up it a little bit. Similar if you're doing other PT exercises or things like walking more, paying attention to how much you're doing, keep it at that rate for a few days, make sure you don't go up or down, because one of the biggest things after we had these surgeries is we want to get back to doing what we were doing. that means we end up pushing ourselves sometimes and we end up going too far. And then the next day we're like, oh, I can't walk, I can't move, I have less range of motion, and everything just kind of freezes up. Don't make rowing add to that. So if you are going on a long walk and then you also want to row, maybe don't increase your walk distance or time the same time you're starting to row or the same time that you're increasing your rowing. Choose one to increase at a time, stay that way for a few days, then push one, see how it goes, push the other, see how it goes, to work your tolerance and your ability for your knee to be comfortable without it getting mad at you. So those are my tips for when it comes to easing back into rowing after a total knee replacement. So I hope that this was helpful. Hit that thumbs up if you liked it, and comment below if you've got questions or concerns. I'd be happy to try and answer or make a video like this one answering your questions. And I hope everyone has an amazing day. Happy rowing.